So today we will talk about the SAMRIDH Initiative. This initiative is basically by the Niti Aayog, AIM and United States Agency basically in the field of health sector. So let's talk about. As I have told you that why in news, this is the initiative of the Niti Aayog Atal Innovation Mission. Remember that this is basically Atal Innovation Mission. Basically for the innovation entrepreneurship comes under the Niti Aayog. So remember that this is an Indian initiative by the Niti Aayog in the field of innovation sector. So recently Niti Aayog, AIM and USA Agency for International Development. So remember that announced a new partnership known as the SAMRIDH Initiative. So if you talk about the full form, then remember that this sustainable access to market and resource for innovative delivery of healthcare. So basically in the field of healthcare, sometimes they give the short form of the SAMRIDH and asked about. So if you know the full form of the SAMRIDH, then you should know that it is the in the healthcare sector. So remember that. If you talk about the objective and aims of the SAMRIDH Initiative, then remember that basically to bridge the supply side gap. As you know, there is a supply side gap in the health sector. Services are not available in the government hospital, sometimes even the private hospital, or either they are the acute shortage of that services. So as you know, and that's why to bridge the supply side gap in the healthcare facilities, if you talk about to respond the health emergency in the immediate like the COVID-19 and medium and the long term in future. So this is the first objective if you talk about. Another is the adoption of innovative and market based health solution. Another objective if you talk about. Another is the promote local and comprehensive solution. As you know, if something which is locally available, then it is available or accessible to the people of that region. So that's why. So promote local and comprehensive solution at the community and facility level for the vulnerable population in the basically the vulnerable area is the objective and aims of this SAMRIDH Initiative. So if you further talk about this SAMRIDH significance, then remember that it will improve the access to affordable and quality healthcare services basically in the tier 2 and tier 3 cities among the rural and tribal area. What are the tier 2 cities and tier 3 cities is basically the local area which not consist of Delhi, Mumbai, Calcutta like cities, that is known as the tier 2 and tier 3 cities. So remember that. So if you talk about another significance, then remember that this initiative is implemented by a technical support unit which will be a global company. So remember that. So AIM and SAMRIDH if you talk about will leverage the philanthropic capital, means as you know, there are the philanthropists in India which actually provide the capital either in the form of money or either in the form of any asset like the healthcare you will make hospital. So that is known as the philanthropist. They will provide the capital. So remember that, and public sector resources to offset barrier, means there will be a combination of public sector, whatever is the public sector resources, as well as the philanthropist, and they will combine to offset the barrier for commercial investment in small and medium healthcare enterprises to invest in scale healthcare solutions. So basically the combination of public sector resources as well as the philanthropist solution to raise the capital in the healthcare sector. So remember that, and provide the solutions to the healthcare sector. So remember that. If you talk about, it will also identify and support a minimum of 35 to 40 healthcare innovators is one of the significance of SAMRIDH Initiative if you talk about. So another significance about the SAMRIDH scheme, then remember that mobilize a capital pool of $100 million plus from the private sector as well as the bilateral organization to support inclusive business model. So remember that. If you talk about strengthen the comprehensive healthcare services focused at the vulnerable 40% of the population with the high disease burden. So remember that. It is also basically to reduce the out-of-pocket expenditure. So remember that out-of-pocket expenditure in India is very high, around the 65% to 70%. So remember that. If there will be an increase around the 2%, 3% of the budget, that it will reduce, it can reduce around the 30% out-of-pocket expenditure. So this is also one of the main of the SAMRIDH scheme. So this is a collaboration between the United States Agency, remember that, and the Indian government, popularly known as think tank Niti Aayog and AIM. There is also a SAMRIDH scheme in India only. Remember that this is basically by the Ministry of Information. Remember that. If you talk about, it is basically the startup accelerator for the MATI, product innovation and development and growth. Basically this is for the software sector. So remember that. So you need to differentiate. Answer will depend on the options available. If they are talking about only the SAMRIDH India, then the option will be provided either for the startup sector or either for the software sector. And if they are talking about the SAMRIDH initiative, then they will provide some hint to you actually conclude the answer. So if you talk about the summary of this video, then remember that this SAMRIDH initiative is a collaboration between the Niti Aayog Atal Innovation Mission under the Niti Aayog and the United State Agency, basically in the healthcare sector. What are the objectives? Basically to bridge the gap of the healthcare facilities provided to the citizen, and basically to raise the health capital in the healthcare sector from the philanthropic capital, as well as to collaborate with the public sector enterprises and reduce the out of expenditure is also one of the significance of the SAMRIDH initiative. So thank you guys, hope you like this video.